Today we will be talking about castrating calves. The first thing we will talk about is what is it and why it is done. Castration is the desexing of a bull or a bull calf. Castrating helps the eliminating of breeding between male and females that would produce less than ideal offspring. It helps make males less dangerous and rowdy towards yourself and other calves. And also helps meet market demand requirements for quality of beef and the sales of beef. You can do this at any age, but you should really not do it older than 8 months old. However, it can be done at any age, including up to the first day of birth. There are different methods, but the most common ones is banding, Burdizo, and surgically. However, I will also mention chemically and the hormonal method. However, it will not be on your quiz. The first method we will talk about is banding. There are two different types of band, an elastrator and a high-tension bander. Today I have with me an elastrator. He used a size of a little rubber ring, about the size of a Cheerio, and then you place it on the prongs on the elastrator. You then pull out this, and you can put this in place, and then you put the testicles under that, so this is above the testicles. You then can slide off the ring and release the elastrator, and then it is in place. This is usually done on younger calves, and a high-tension bander is used for larger calves or older calves. Some of the problems with banding, however, is it's looked down upon by many different animal welfare groups. If both testicles are not underneath the band, it will not fully castrate the animal, and it is much harder on fleshier calves. The second method I will talk about is the Burdizo method. The Burdizo method crushes the blood vessels, which kills the testicle because it does not have any blood supply. Good restraint is essential to using the Burdizo because you must hold it in place for 10 seconds to completely crush the blood vessels. There is acute pain caused by the Burdizo, but it is not as much as surgically or a rubber ring or a latex band castration. There is also less reduction in weight gain after castration compared to surgical or a latex band. The next method is surgically. Surgical castration is the most certain method of castration because the testicles are removed completely. However, the risk of infections is increased because it is an open wound, and it is not recommended for feedlots with wet and muddy conditions. It is done more in dry conditions. I have a short video talking about how surgical castration is done. You do not have to watch it, however, if you do not want to. You will first disinfect your hands and the knife that you will be cutting with. He will show exactly where to place the knife above the testicle and cut it. And then, so this shows, this is the skin around the testicle, and before you can cut, you must push the skin down, and this will help make not as big of a mess, and won't be as much blood then. And then you can make a cut across the blood supply. And this will completely remove the testicle. When the video comes back on, he will then show the method that he just showed there. And then he will do this with the other testicle. You can see, however, after he lets the calf go, he is not in too much pain because he gets back and joins his friends right away. The next method I'll talk about is chemically. This is an injection of sclerosing or toxic agents, which is 88% lactic acid, into the testicular parenchyma to cause irreplaceable damage and loss of function to the testicles. This requires much additional procedural time and technical skill, and it takes twice as long to heal. The other method is the hormonal method, which is also known as immunocastration. Immunocastration shows to increase live weight, hot carcass weight, average daily gain, and dressing percentage following castration when compared to surgical methods. However, it is still not as commonly used as other methods, It works by injecting the immunocontraceptive into the antibody production against gonadotropin releasing hormone. Next, we will move on to the quiz.